Hi guys, welcome back to Why Are We Gaming. This is another surgery.
Woo!
This one isn't as invasive as the other ones. This is actually a hair transplant.
I'm
So,
still annoyed that there's no lobotomy.
Matt, if I ever find an online lobotomy, you'll be the first to know.
Thank you. Well, technically, I'll be the second because you'd be the first.
Welcome to Surgery Squad's virtual hair transplant. I'm Dr. Susie, and I'll be assisting you with this surgery today.
Damn it, Susie! We
A hair
want Jeff.
transplant is an outpatient procedure that
What
involves
Jeff?
transplanting hair
I miss
follicles
Jeff.
from one part of the body,
Jeff's
known as
forehead.
the donor site, to the balding part of the body, known as the recipient site. Although hair
So,
transplantations
she's
are
saying is-
typically used to treat male pattern baldness and restore eyebrows, beard, or chest hair, they can also be used to fill in scars caused by accidents or surgery. Today we'll be using the strip harvesting method to treat our patient's male pattern baldness. Strip harvesting involves removing a small strip of scalp from the donor site under local anesthesia and transplanting the pieces or grafts of the scalp into the recipient site of the patient's head. Before the surgery, our patient was advised by his doctor to avoid using any medications that may result in a poor take of the grafts. These medications include, but are not limited to, aspirin, ibuprofen, and antacids. Alcohol use and smoking
herbal,
before and
or
after the surgery can also result in
supplement.
poor graft survival.
Vitamins.
To prepare our patient for the procedure, we'll need to first shampoo his hair with an antibacterial agent to help
Alright,
prevent
got it.
any infection.
Shampoo his hair with an
I think
antibacterial
you can
agent.
handle that.
Oh yeah. Just write your name in all its glory. Yep, that's your name. Paint. How appropriate, Dr. Asa. You really like the... Man, this is like a special kind of party, isn't it? So now that you're done drawing rocket ships on the patient's head... Oh no, you're not done. Okay. I can imagine you being a nurse and the doctor coming in. Why'd you draw penises on this man's head? Just yes? Not good enough for me.
Okay, now I'm done. Gotta get a good lather going.
You gotta work up that penis lather. So the procedure is we're gonna shave his ass and put it on his head.
Yes.
So fresh and clean.
Oh
Thoroughly
yeah, so
rinse the
fresh and
patient's
clean.
hair, and we're ready to get started.
God, so wrong.
I'm a mature adult.
Yes, you are a mature adult.
How you doing, buddy?
I think he's passed out. It doesn't matter what he's doing. That's clean enough.
I don't think he's passed out. I
The
think it's
next
a...
step is to define our patient's target hairline. Go ahead and outline where we want the patient's hairline to be.
Really? Do it. I'm surprised you didn't just write in Why Are We Gaming. Oh, you are writing Why Are We Gaming.
I was actually gonna put was here.
Oh, okay, yeah, it was here. Oh. Perfect.
That looks good to me.
Yeah, perfect.
Let's prepare the donor
awesome.
site. We'll begin by trimming the patient's hair in that area.
Trimming the hair and that. Here we go. We're gonna buzz it. Oh.
That looks about right.
Now that the
I like how you
patient's
did
hair
it
is
so
trimmed down,
perfectly, even though
we'll
you're
need to
just
mark
doing
the
it all
area that we'll be
half-assed.
removing.
Kind of looks like a shark. You should draw shark teeth on it.
That's actually what I was gonna do.
Oh, wow. Great minds think alike.
Doc, what are you doing back there? Nothing? Nothing? Science doctor stuff?
Science doctor's things. Also draw big eyes if you can. On the back of his head. No, higher up.
I can't.
Yeah, higher up.
I can't.
Aw. Well, that sucks balls. Some sort of weird monster thing. So you ever
That
seen
works,
the
that
movie
works.
Teeth?
Matt,
Great
no.
job! Inject local anesthetic into the marked injection sites to reduce the amount of discomfort our patient may experience.
Alright.
Just
Stabby, stabby.
inject it in his brain. Right in his brain.
Matt, this needle isn't that strong.
In all of his brain.
Matt?
You're not hitting it hard
Great,
enough.
he
You gotta
won't
go
feel a
in a
thing.
downward stabby motion.
Now we'll need to remove the piece of scalp we outlined from the donor site. Use the
Yes.
scalpel and cut along the line to begin the process.
Remember, you have to go in a sine motion. That is how real doctors do it. They go back and forth in like a sine motion
Like this?
to make sure they got all of the... Yes, that's perfect.
Next, we remove the
What
piece
it
of
does-
scalp from the donor site. Make sure you have a good grip.
You just rip. It's like a Band-Aid, right? You gotta just pull it off.
Ew. So gooey. Hey, Matt. Matt. Hey, buddy. How's it going? My name's Jerry.
Doctor, what are you doing back there? Doctor. Oh, yeah.
Once removed,
It's
we'll
stuck.
prepare the piece of scalp for
Did you hear it?
grafting
Like
by
Band-Aid?
dissecting the
Yeah.
individual follicles. But before we do that, why don't you go ahead and suture the donor site?
No, I don't think so. I think I'll just leave this huge gaping wound in the back of his head.
Round and round we go. Where we stop?
Nobody knows. I'm looking
I went-
at the...
I think I went on a roller coaster that was like that.
What, they sliced open the back of your head?
Yeah.
Oh,
I think they put a transmitter in my brain.
sure they did, Matt.
That's why every time I bark, I taste purple.
Great, let's get to some dissecting.
What?
The first thing that we need to do is cut the removed scalp into sections. We'll dissect this one section of skin while our medical assistants take care of the others. Let's
Yep, that
remove
is
the
skin.
individual follicles from the donor material using a pair of tweezers and a sterile razor.
Oh, this noise, Matt. This noise you're about to hear is a good one. It's one of my favorites.
Oh, yeah.
Mm-hmm.
It's like buttering a turkey.
It is kind of like buttering a turkey, isn't it?
Nice job. This step is repeated thousands of times to get each follicle prepared. I'll have my assistants finish up. To prepare the recipient site, you'll need to first inject a local anesthetic into the scalp. We don't want our patient to be uncomfortable.
Says you.
How much did we inject?
Now we need to make
Just
tiny incisions
wondering.
into the
I
recipient
don't
site
know.
so that we can place the grafts into the scalp. Use
All I
the
know is he is
microblade
a
to make the
very
incisions
happy
in the
man.
recipient site.
Microblade. And we gotta sit here for every single...
Perfect. With all of the
all
incisions,
those
it's getting a little messy there. Let's get that cleaned up.
No, I like it.
It's like doll hair. I think that's the same way they put doll hair on.
There we go. Nice and clean.
Surprised your
Much
marker
better.
didn't wipe off.
I know,
Use
right?
your tweezers to pick up and insert the hair grafts
This
into
part
the
grosses me
recipient
out for some
area.
reason. Just give me a damn hair!
Plant those little hairs, Asa.
I am...
Plant them. Like little trees in a forest of hair.
Except, this is like planting trees in a desert of scalp.
And to think, every time I donate to a forest charity, this is what they do.
You're a natural. Now that you've got the hang of it, we'll repeat these steps for the remainder of the recipient site. After the procedure has been completed, our patient will be prescribed antibiotics to prevent wound or graft infections. For up to a week after the procedure, the donor area may be sore and some numbness may be experienced as well. Our patient can also
Look at that
expect
hair.
moderate
That is
swelling
awesome
and
hair.
redness during
Matt?
this time.
Yes.
Shampooing of the recipient area is typically
Did she
started
say
2
there will be
days after the
soreness
surgery.
and numbness?
This is important as
Yes.
it prevents scabs from forming. If scabs do form and are left to bond to the hair shaft, the newly transplanted hair follicles may be lost. In about 10 days, our patient will return to have his sutures removed. During the first few days after surgery, almost all of the transplanted hairs will fall out due to shock loss. Shock loss occurs when the hairs are traumatized by their relocation. Within 2 to 3 months, the patient can
Rape
expect
face.
new hair to begin to grow from the treated area and continue to thicken during the following 6 to 9 months.
That
And that's
was the
hair
rapiest of
transplant
faces.
surgery. Why not try your surgical skills in another surgery here on SurgerySquad.com?
I would love to, but no. Okay, this has been Asa and Matt with another surgery. Oh God, I hate my life.
Delicious. So this is how you prep people to be eaten. Nice.
Yes. Oh man.
Okay, we should do one more. One more.
Okay.
And I think this will probably be the grossest one.
Okay, I think you're right. I think I know which one you're talking about.
Yep. Until next time.
Bye. Like, comment,
Like,
subscribe.
comment, subscribe.